Hi, I'm Diana, and I had stem cell injections, and one of them was in my left shoulder. Before that, I had shoulder pain for approximately 10 years, and it just got progressively worse, especially the last 5 years, to the point where my entire upper left quadrant was in pain all the time. Very hard to roll over in bed or do anything that I would need strength for from my shoulder. And anyway, so I got the stem cell injection, and in the first 2 weeks, maybe almost 3, I actually experienced more pain in my shoulder. I'm a therapist myself, and so I know that that's usually a sign of regeneration or that something's happening. So I just waited through it and didn't over-exercise or overdo anything. I was instructed to take it easy for a while, which was kind of hard.
But you did some stuff.
I was, did a little bit, and I started doing a little bit exercises, but very not major. Then I had, then after about 3 weeks, at about 3 weeks, sometimes I get a stabbing pain or a shooting pain, but I knew something was happening, aching. And then after about 3 weeks, that didn't happen anymore at all. And now it's better. Now it's there is like a smaller aching there, nothing like before. And
how often do you have that small aching? Is it
the small aching is there pretty much a lot of the time, like it was before.
okay?
But the intermittent, it's so much less than it was.
Okay.
And then the intermittent pain, like maybe if I roll over wrong in bed, or not if I don't do anything, it doesn't do anything.
Okay.
But maybe if I turn the wrong way or use it the wrong way or too much, then I'll get a little pain. But it's nothing like it was.
Awesome. So
Yeah.
something you'd recommend for people with shoulder problems?
I would. It's been a good decision, I think.
Awesome. Thanks for sharing.
Sure.